in terms of my background, I have a background in statistics and quantitative methods, and I was always drawn to the public health applications of statistics and medical applications, particularly population and public health. So after I graduated, I went to the Demographic and Health Survey project, which was a fantastic opportunity to work with such an immense data set. It was just a huge amount of data, and I think from there I got interested in linking the data to the programs more closely to better understand how programs are working and what works, and that I think naturally led into monitoring and evaluation. I think monitoring and evaluation is an organized approach to understanding how well programs work and what they're achieving, whether they're achieving what they're supposed to achieve. So it's getting an idea of whether activities are being implemented as they were expected to be implemented, whether the kind of outputs and things that the project is producing are what we're expected it's producing, what it was expected to produce, and then ultimately whether it's having the impact on the outcomes that it was intended to have impacts on. Then that information can then be used to strengthen the M&E programs, to better understand what works so you can do better, and also to ultimately to demonstrate the impact of the programs and advocate for resources. Well, I think in the family planning field there's a long history of investing in information systems, and you can go back to historically to the World Fertility Survey in the 1970s, which was very pioneering and was to inform family planning programs at the time. So in that sense there has always been a history in the family planning field in to invest in some kind of information for decision making. I think M&E, as we think of it now, has been more formalized and systematized probably since the early 1990s, and I think it has got on. I think there is a great deal of awareness now around monitoring and evaluation. I think one experience I particularly remember on a positive way was in Turkey, working with the USAID family planning program in Turkey. That was really almost a perfect experience in terms of designing an M&E plan. There was very strong leadership from the USAID officer in the country. They had very good technical support. One of the partners on the project had excellent technical skills and was also very dynamic, a lot of energy, a lot of leadership. And then they used a very participatory process where they got all of the stakeholders involved, from the government stakeholders, the implementing partners, brought them all together to agree on what they wanted to measure, so they agreed on the indicators, agreed on how they were going to collect the data. Then there was a data collection exercise, and then they also got together to look at the targets. And then most importantly, I think they then used the information. They would meet regularly, look at the data, use that information to improve the programs, to plan for the future. And so I think that was really an excellent example of M&E at its best.